You're back with us. I just kind of wanted to, if you wouldn't mind.
No, I don't mind.
Just kind of tell me what made you seek us out?
Well, I had gone to a doctor in Alexandria when I was living there, and she had helped me immensely. And then a few years later, I had a tooth that had to come out. And so the splint she gave me wasn't fitting quite right. And so sometime in January last year, maybe it was the year before even. Yeah, anyway, can't remember. I had to stop wearing it because of the different things that were going on in my mouth. And she wasn't available for me to get in and get another splint. And my two dentists there in Woodbridge weren't very helpful. So then we moved here.
Right.
And I told my new dentist that I really needed to see a dentist who could help me with my TMJ. And he suggested somebody in Portland, but that person's not working there anymore or doing this anymore.
Yeah.
And so the next thing they did is call me and said, you need to go see Dr. Sutter. That's the reason I sought you out, because my jaw was so bad and so painful that it was just annoying as heck, and would not allow me to rest well, to eat, without worrying about something not working right.
Sure.
So yeah, and I've lived with TMJ for, almost 40 years.
Okay. So take me through some of the symptoms. Like, what would you normally, like, I get that, trouble sleeping and discomfort, but like, was it migraines? Was it facial burning, pain behind the eye? Like, what was going on?
Sometimes I don't call them migraines, but just more headaches than normal.
Sure.
Because it would and then it was like a popping sound, or I couldn't yawn without it just killing me. It would actually, to the point of almost locking shut, or locking open, in fact. Mostly locking shut is what I've had. And then just other pains like throughout my neck and my back that were never helped by the chiropractor.
Okay. And so where are we? This is our second visit, third visit? Where are we at?
The first one, second, third. This is the third.
Third visit.
Third visit.
Okay. So are you saying that since we've undergone this therapy that some of the aches and pains in your neck, your shoulders, your back aren't there?
I am saying that.
Okay. And what about the jaw pain? Are you able to eat what
Yes,
you want?
I'm able to eat what I want, and I'm even almost the point where I can yawn again without worrying about it.
Okay.
The pain is significantly gone down. And the best part about it is I don't have to wear anything at night when I go to bed.
That's a great thing.
I just love it.
Yeah. I remember during the consultation that we had when you first came to the office, I was like, oh yeah, and if you do this, you don't have to wear your night guard or your appliance. And you kind of looked at me like you were puzzled, like that's how is it sleeping without one if you've been sleeping with one for so many years?
It's totally freeing. And I still tend to, what have I forgotten to do before I go to bed? I still think about it,
Sure.
And I've actually still got that night guard down in the drawer. I haven't yet thrown it out. I don't know why, but maybe.
Yeah. Don't throw it away. Don't throw it away. Just, don't use it, but,
and I'm not.
But, this has only been like a few months, right?
Right.
You get to 10 or 12 months, you throw it away. It doesn't, you don't need it at that point. But, yeah, I like the direction you're going in. I think that, with just a little bit more time, you're going to get some more out of this. But usually a lot of times what we see is, there's this huge release of tension and the benefit gained in the beginning. And then what happens is it tapers off and it kind of goes a little slower. You need more time to heal, in between appointments and those kinds of things. So, I still fully expect you to get some more out of this.
Okay.
But unlike the first visit when the change was so great,
Yeah.
this is going to take months because
Okay.
you're getting the last, like, what? How much improvement would you say you've had since the first 2 visits?
Well, the 75% that I gave you after the first visit,
Sure.
for sure. And then I would say because the pain in my right is gone down significantly even since my last visit.
Okay.
And it's just not constant anymore.
Okay.
It's just a twinge once in a while, and it's not a bad pain. It just
Annoying.
tightness. Yeah.
Okay.
It's just a tightness.
Well, and so again, that just kind of reiterates exactly what I said. So what I expect is, the more you get to the 100% mark, the more this is going to go very slow.
Okay.
And there'll probably be a couple times where you drive up here, we hook you all up, and there's nothing to adjust.
Right.
And then you just need more time.
Okay.
Okay. So I like that we're still going in the right direction, but glad you did it.
Oh, yes.
Okay.
Yeah, I continually praise the Lord for having found you, because that was just, yeah. Oh, yeah, I'm so glad I did it. And, insurance wise, I have to be honest, it was a lot of money to fork out, but it's worth every penny.
There you go. I've had a couple of patients say to me, Doc, it's too much. I can't swing it. I've had other patients come in and tell me, if I knew I was going to feel this good, I would have paid you more. And so that kind of tells me, like, all right, well, I'm probably in the right spot price wise, but the first, 10 years I was doing this, I didn't raise the price at all.
Wow.
I just left it where it was.
Yeah.
So, and the benefit of that, I think, is getting to see more people. Yes, it is still it's still expensive, and it's an investment in time and money. I mean, everything's time and money, right?
Right.
But it's easy to sing those praises when you're getting, 2 visits. I'm 80% better. I don't have to wear a night guard. I don't have surgery. I don't have medications I have to wear or Botox or any of that stuff. Just getting the bite right, and just letting the body, kind of heal itself.
Yeah.
So good.
Yeah.
All right. Well, I'm going to call Miss Whitney in here, and we're going to just jump right in and see where you're at today. Okay.
Sounds great.